Conventional cancer care looks at nutrition, what you put in your mouth, as playing no value in both the cause of cancer or the process of treatment in cancer. That's a very dangerous road to tread. Two recent studies have highlighted this. One is the prospective urban and rural epidemiology study that showed that essentially cancer is a disease of high income. It's a disease of poor nutrition and lifestyle. The second is a recent study, several recent studies that show that diet, whether it's a Western diet and the metabolites associated with it, or eating fermented foods or greens, plant-based diet and the metabolites associated with it, are a way to not only cause DNA damage, but it's also a way to counter cancer growth, but also change metabolomics, metabolites. And in fact, when you look at this process called dis-ease, which is disease as we know it, it literally means the lack of wellness. Disease, or the lack of wellness, is manifested from nutrition. Thus, there's no way to be able to counter that process without including nutrition. Now, when you look at conventional cancer care, they say sugar plays no role in cancer. Yet there's, Otto Warburg won the Nobel Prize for Medicine and Physiology back in the early part of the 20th century for his work in the altered energy cycle in cancer cells and how it uses sugar inefficiently, but for speed. And when you look at this process, they say it plays no role despite the evidence, and then they go ahead and they write you an order for a PET CT scan, which is where they give you radioactive isotope sugar to be able to show the metabolic changes of cancer that separate themselves from the rest of the body. So that right there is proving the concept that metabolism, that nutrition can play an active role in cancer, because glucose is obviously a big component of nutrition. But as I mentioned with research, nutrition shows that it is instrumental in laying the foundation that alters the gut flora, that changes the environment of the body, that promotes cancer. But we now know that nutrition is foundational in changing that environment through the gut microbiome, through the rest of the body, to reduce systemic inflammation. Nutrition, it's foundational to the process that changes the environment that allows the body to heal against cancer. Intuitively, we know this. If you eat Twinkies, Ding Dongs, and drink Coke, you feed junk, you expect junk out. But here, if you feed the body actually nutrition, if you take nutrition as a love language, as a means to communicate with your body, if you give your body what it needs, guess what you're going to get back? You're going to get back good things. You're going to get an immune system that's strong, an immune system that targets the cancer, an environment that doesn't allow cancer to grow or doesn't allow it to grow easily. Nutrition is foundational to cancer healing and cancer treatment as a standalone therapy, but more so in conjunction with other therapies. Conventional research shows that nutrition augments chemotherapy and radiation. That's the power of nutrition. It's simple, it's what you put in your mouth, but it is powerful and foundational to an integrative, holistic cancer treating program like what we provide here at Brio-Medical, but we customize it for you. There's no one-size-fits-all approach here. It's customized, it's precise for you. I'm Dr. Nathan Goodyear, Medical Director here at Brio-Medical in Scottsdale, Arizona. If you want to learn more about what a holistic, integrative, precise nutrition program looks like for you in your cancer healing journey, I encourage you to go to our website at www.brio-medical.com. I look forward to talking to you or meeting you soon.